Andy, thanks so much for joining us today.
Thanks for having me.
So we're about 15 to 20 years into the implementation of EHRs here in the United States. What does the landscape look like today?
Yeah, it's very interesting. The landscape has changed quite a bit recently. And so what we're seeing now is really 4 major vendors in the market right now. They are fully integrated systems, which are very nice. So now the lab systems are all-inclusive. So we're moving away from best of breed, which is something we used to have before. And now we're looking into all-inclusive systems that can do everything. So right now they're very complex and something that we're seeing a lot of consolidation, but it's something that I think is exciting. I don't think we're anywhere near the end point. I think we still have a long way to go, but we need to figure out what that path is.
So you mentioned that EHRs have become sort of everything to everyone. And this is one of the pain points is that it does workflow, it's designed to gather data, rev cycle, back-end kind of stuff. And this is contributing to things like physician burnout. So how are health systems coping with that?
Yeah, I mean, it's interesting. Everyone's doing it a little different on each of the health systems. It really is a tough time for health systems. Looking at cost of change is in the hundreds of millions of dollars. The ROI is very difficult to get back. So you really have to look at, why you're doing this and what the reasons are. It's not just a quick decision by a health system. It literally is extremely one of the most important decisions health systems have to make. Unfortunately, they're in the business of providing care, but one of their most important decisions is technology that they're utilizing to provide that care, and that's a difficult spot.
And so what does the roadmap look like then for health systems as they're doing their strategic planning, and how does that align with vendor roadmaps?
Yeah, I mean, that's a great question because really I think the institutional needs are not necessarily always the vendor focus. It takes a year to 2 years to bring in new functionality. And so I think the roadmap going forward is we need to get the vendors and the institutions on the same page, figuring out where is the pathway that they need to go. Physicians are very powerful in today's world. And so that is one of the things we need to look at is what do the physician need? What does the clinicians need? And how is that going to support them?
Some of the vendors have made sort of major announcements as to what their priorities are in the very near future. So what should health systems be thinking about in terms of the immediate future for themselves? And then how is that reflected into what their priorities should be moving forward?
I mean, we looked at a couple of years ago, we basically had the government providing a carrot. And so millions of dollars were put into it, billions of dollars were put into the system. So the health systems really sat back and utilized that money to implement their systems. The last 2 or 3 years, there hasn't been a lot of movement. There are hundreds and hundreds of applications, not just the EHR, that have to be moved. So strategic planning is a huge situation that you need to really go in and understand. As we talked about total cost of ownership, the financial cost of that, but also the resource cost of that. Do you have the manpower within your institution to be able to do this? If not, you have to get it somewhere. So that cost is very expensive.
Andy, thanks so much for having this discussion with us today.
Thank you very much.